All right, good afternoon, everyone, and welcome to today's joint webinar co-sponsored by Jordan Center at NYU, Harriman Institute at Columbia University. My name is Alex Cooley, professor of political science at Barnard College and the current director of the Harriman Institute. It's a great pleasure on behalf of me and my co-chair Josh Tucker to welcome you to this roundtable on fighting HIV, AIDS in Russia, challenges, successes, and working in a pandemic. This is our first Russia Public Policy Seminar of 2021, so Happy New Year, everyone. And the purpose of the session today, as with all of our sessions, is to bring informed cross-disciplinary and cross-professional analysis to some pressing topics so that we can inform our conversations about Russia with better expertise, better data, and better research. The issue today, HIV/AIDS, some might call it the forgotten pandemic. It's important not only in its own right, but also how it intersects, I would say, with some of the COVID dimensions today. We have a very packed lineup of 5 speakers. Before I hand it off to Josh, who will be moderating and introducing them, I just want to say a special thank you to Sasha Spitalnik for thinking about the panel, organizing it, and getting us off to such a wonderful start. So thank you, Sasha, for that. Josh, over to you. Welcome again, everyone.
Okay, thanks so much, Alex. And I think you said this, but I also want to thank the Carnegie Corporation of New York for providing funding that underwrites these New York City Russia Public Policy series as well. So as Alex mentioned, we have a fantastic panel for you here today. So without further ado, I'm going to go through. What we'll do, as we've done on these webinars previously, is I will introduce each of the speakers in turn instead of introducing all of them now at the beginning. I would also call attention to everybody that now I assume most people are familiar with Zoom webinars, but if you're not, you can ask questions at any time using the Q&A function that you'll see at the bottom of the Zoom screen. Those of you who are watching on YouTube, you feel welcome to ask questions in the chat there on YouTube, and we'll be looking there as well. And we will take questions after the speakers have spoken, but it'd be great, for you to leave those questions along in the Q&A as people are speaking, as things pop into your head as we're going along. So without further ado, I'm going to begin by introducing our first speaker, Ulla Pape, who is a postdoc researcher at the Freie University Berlin in Germany. Prior to that, she was a lecturer in European Studies at the University of Bremen, senior researcher at the Higher School of Economics in Moscow, and postdoc researcher at the Third Sector Impact Project at Radboud University, Nijmegen. I hope I pronounced that correctly. Her main research interests include social policy, health, civil society development in Russia and Europe. Ulla, please take it away.
Yeah, okay. Good evening, everybody. Let me share my screen with you. Okay. Yeah, thank you. Thanks a lot for inviting me to this debate. I'm really, yeah, I think it's a great topic. And now let me talk about HIV in Russia. Since I'm the first speaker today, I thought that I'd start with some basic fact about HIV in Russia. Unlike most countries, the HIV epidemic is growing in Russia with a rate of new infection rising between 10 and 15% each year. This means that over 250 people in Russia become infected every day. In fact, the region of Eastern Europe and Central Asia is the only region in the world where the epidemic of HIV/AIDS is still growing. And as has been mentioned already, yeah, HIV/AIDS is a forgotten epidemic, one can say, and not so many people are aware of the fact that the region of Eastern Europe and Central Asia is affected, it's so much affected by it. Russia is particularly affected. In 2015, it accounted for 80% of the region's new infections. So today, and the newest numbers I could find are from the end of 2019, the cumulative number of HIV infections in the country is 1.4 million. That means that about 1 million Russians are currently living with HIV, and that is roughly 1.2% of the adult population. So what we can see here is generalization of the epidemic. So It has been concentrated in high-risk group or vulnerable population, but nowadays it is generalized in the Russian population. The vulnerable population groups include injecting drug users, sex workers, and men having sex with men. And what is important, and I think we will talk about this this evening, is that the spread of HIV is reinforced through marginalization, criminalization, poverty, and limited access to healthcare services. Here I would like to show you the development of the epidemic, starting from 1987 and going to until today. This information is based on data from the Russian Federal AIDS Center. Here it's important to know that Russia has an extensive system of registering HIV infections. So all infections are actually registered in this Russian Federal AIDS Center with regional branches. But still there's a lot of debate on the actual accuracy of the data. So many public health experts actually think that about twice as many people are actually living with HIV, so that the number of infection is highly underreported. So let me give you some more information about the key affected population in Russia. So whom did the epidemic affect? First and foremost, these are people who inject drugs. Russia had the highest number of people who inject drugs in the regions. Estimations again speak about 1.8 million, which is about 2.3% of the adult population. And the criminalization, extreme marginalization of people who inject drugs, actually fuels the epidemic. And one aspect of this is that so-called harm reduction services have a very low coverage. So they are mainly run by non-governmental organizations. The second key affected population in Russia are prisoners. Prisons are a high-risk environment for HIV and also for tuberculosis. The co-infection HIV and tuberculosis has an especially high risk of mortality. And there are 6.5% of prisoners are estimated to be living with HIV, but only 5% of these receive antiretroviral treatment, which means that if you are in prison and you are HIV positive, it's very likely that you develop either AIDS or tuberculosis, and the mortality is very high among these people. The third group I would like to draw your attention to are men who have sex with men. There's limited data. Some people estimate that about 10% of men having sex with men actually are HIV positive, but we do not have accurate data on this. Most likely the data we have are underreported, which means that people who turn to the institutions are likely not to report the means of transmission. Because of repression, I mean particular repression against this group, HIV treatment coverage is particularly low. And the fourth groups are sex workers. Between 3 and 11% are HIV positive, and very important factor is that sex workers often face violence, and this contributes to the spread of HIV. So now you can ask, why has Russia failed? Yeah, so many countries in the world and countries who are much poorer than Russia in economic terms have successfully addressed HIV and AIDS, but Russia has failed. Also in the region, it's interesting that Russia scores very low. And this has to do with the following factors. First, we can see an insufficient prevention effort among vulnerable groups, the groups that I mentioned. just right now, and especially important is the lack of harm reduction programs for injecting drug users. And the punitive drug laws hamper access of drug users to the medical services that are present. So it's not only the lack of services, but also the barriers to services. The second factor is an insufficient progress toward the 1990 targets of the UN-AIDS. So in Russia, Russia is far away from this target. Only 80% of people with HIV are aware of their status, only 45% of them receive treatment, and only 75 are virally suppressed. This means that the percentage of people who should be receiving or should be virally suppressed is very low. Yeah, so it's a huge problem that access to antiretroviral treatment is very low, and this is a major barrier. Another factor that is actually contributing to this policy failure is a low awareness among the general population. So not only among vulnerable groups, but among the general population. This has to do with the fact that there's no systematic sex education in schools, and there are public awareness campaigns, but one can argue whether they are appropriate. So also the work with the general population is not appropriate. And as a result, HIV is often seen as a problem for vulnerable groups. So people distance themselves from this problem, which is understandable, but it also represents a barrier in the response to the epidemic. Stigma and discrimination, and especially the violations of basic human rights, forms a very important barrier in the response to HIV. And it especially affects the vulnerable groups and people who live with HIV. If we put all this together, we can see that the reason for Russia failing in the response is actually poor governance. So the Russian government do not prioritize an effective response to HIV. And actually, the Russian government restricts the work of civil society organizations in the work against the epidemic. It has moved away from an evidence prevention approach to prevention endorsed by international organizations, and prioritize kind of national programs, focusing, for instance, on so-called healthy lifestyle promotion. This approach is inadequate for addressing HIV. And a number of legal regulations, such as punitive drug laws, discrimination, police harassment against drug users, but also specific legislation hampering the work of LGBT organizations. This all hampers the outreach to vulnerable populations, and it hampers the effective work in the field of HIV/AIDS. However, there's still hope. What is changing? I mean, a lot of these things have been the same over the last years, but changing is civil society is still playing an active role. New organizations have emerged in Russia's region. This is especially important, that it's not only in Moscow and St. Petersburg, but also in the regions. And you can also see a solidarity among civil society organizations. So other social organizations also take up the issue of HIV and AIDS. The image of HIV has been changing. So there are more and more people living with HIV who speak out in the media. There has been an influential YouTube documentary in 2020. More active AIDS service organizations mean also greater visibility of people living with HIV. And this eventually leads to a growing awareness and acceptance. What you can see is that society is changing. I mean, stigma and discrimination still plays a major role, but one can see that among the younger generation, it is decreasing. So also, as an example, homophobia is less pronounced among younger Russians. Yeah, so there are more people who in general are open and less scared about HIV. What has been the impact on COVID-19, on HIV and AIDS in Russia? Two things came to my mind. First, impact on the situation of people living with HIV. First, people with HIV are more susceptible to COVID-19, so they form a risk group for COVID as well. What has been interesting in Russia is that they are less likely to seek testing and treatment for COVID-19. This again has to do with the stigma and the discrimination. So people who are far away from public health institutions are less likely to seek treatment. There have been difficulties with the supply of antiretroviral treatment, and in general, a decrease of public funding for HIV, as the Russian government needed resources for the response to COVID-19. So also here we see more difficulties in treating HIV. There's also an impact on AIDS services. So services for vulnerable groups are extremely difficult during a lockdown. Everybody can imagine this, and I think we saw a similar development in many countries in Europe. This especially holds true for street work, because if people are not allowed to go out, then there is no access to people who are on the streets. So this about my input, and I'm looking forward to the debate.
Thank you so much, Ulla. Our next speaker will be Robert Heimer, who has spent 3 decades conducting research at the intersection of infectious diseases and substance abuses. His areas of investigations have included syringe exchange and other harm reduction programs, HIV and hepatitis C survival in syringes, overdose prevention and resuscitation, and treatment of opiate use disorder, seeking to provide prevention and healthcare practitioners with information needed to assist their educational and advocacy experts. His work on these issues in Russia has been conducted primarily in St. Petersburg and Kazan, but has included research efforts in all 7 regions, and he is currently a professor at the Yale School of Public Health. Robert Heimer?
Hello, everyone. Thank you for that nice introduction. I wear 2 hats, kind of, one as an epidemiologist and the other as an activist. So I'm going to talk about both of those things, starting with putting on my epidemiologist hat. Looking at the trends in the epidemic that Ulla started to talk about a little bit in the beginning of her talk, one of the things that one notices is there's been, over the past several years, about a 1/3 reduction in new HIV diagnoses in Russia, from about 3.3 per 100,000 people to around 2 per 100,000 people. This is a significant reduction, and one is forced to ask the question, is this an accurate reflection of events on the ground in Russia, or is this simply a sampling artifact in that less testing is being done among the vulnerable groups that Ulla mentioned? Is this really a reflection of any kind of success in stemming the epidemic? These are questions to which I don't know the answers to. My work in Russia over the last 5 or 6 years has been somewhat limited. So I must say that it's quite clear that the reduction of diagnoses among the high-risk groups has decreased even more than the overall reduction. And this is clearly a sampling bias artifact in that the ability to test people in circumstances where they get categorized as members of those vulnerable groups has diminished. Much of the testing in the beginning of the epidemic that demonstrated a very rapidly growing epidemic in people who inject drugs was the fact that people were going for treatment for their opioid use problem. They were being tested at drug treatment, narcology clinics, narcology dispensaries. They were then being labeled as drug users. That they no longer rely on these clinics. They no longer see the benefit of abstinence-based treatment, which is the only kind of treatment available in Russia. And therefore, they really don't, we're not seeing an accurate reflection of this. So as an epidemiologist, I feel kind of frustrated in that it's very hard to get reliable statistics about the true dimension of the HIV epidemic in Russia. As Ula pointed out, there's a big difference between the 80% of the population that is HIV positive and knows it in official reporting, and estimates that maybe as much as only 50% of the people who are HIV positive have been tested and know. So, it's very hard to get an accurate picture when the statistics are so unreliable. And this extends as well to AIDS deaths, and this has some correlation to COVID-related deaths, in that the Russian reporting system reports really, the death certificates report only the proximal cause of death. So when people with HIV died of tuberculosis, and when people with COVID died of pneumonia, they didn't go down as COVID deaths or as AIDS deaths. So it's very hard as an epidemiologist, frustrating as an epidemiologist to deal with this. As an activist, we've had some successes in Russia over those 30 years that I've been working there, both in the two cities where I did most of my work. The work in Kazan, which began about the same time that I began my work in Russia, proved to be remarkably successful for the short run in reducing HIV transmission in the drug-using population, and from the drug-using population to the general population, in getting people who are HIV-positive drug users into treatment. And almost all of that work has been sacrificed by the absence of continued funding. So that's very frustrating, again, to see something that's successful go by the wayside. There's a phrase we use a lot, which is death by pilot, when civil societies that are reliant on external funding, international funding for projects, and that funding disappears, and the local governments don't step into the breach, these programs die. In St. Petersburg, on the other hand, we were quite successful in working with the city government for a short period of time, for about 3 years, to get them to start introducing much more broad HIV prevention and treatment programs. That too, unfortunately, has disappeared, as the very people we worked assiduously to try to educate, support, get to see the benefits of a harm reduction treatment for, accelerated treatment for drug users approach to managing the epidemic have lost their positions and are replaced by people who are more in line with the current, healthy lifestyle approach that minimizes effective public health measures. And as I said, I haven't been able to work all that much recently in Russia. I was supposed to go back this year, but the pandemic has prevented me from going and setting up a project we were starting. So I'm less familiar with what's going on the ground now. So I'm glad that I'm being followed by Anya Sarang, who can talk about the experiences that are going on right now. So I'm just going to yield the floor to her at this point.
Okay, thank you so much. And Anya is up next. So Anya Sarang is a public health activist from Moscow, Russia. She's the founder and current president of the Russian Harm Reduction Network and the Andrei Rykov Foundation for Health and Social Justice. the main advocacy groups fighting for the rights and health of people who use drugs in Russia. While focusing mostly on her NGO work and human rights activism, she's also participated in a number of research projects and published over 25 papers in peer-reviewed journals, mainly qualitative research in human rights, structural violence, and access to prevention and treatment of HIV, hepatitis C, tuberculosis, and overdose, as well as gender and sexuality. Anya Sarang?
Hi, everyone. Thank you very much for inviting me to speak here. I'm really happy to see everyone and to talk after Ula and Robert. I want to thank you guys for keeping your focus on Russia. This is really great, and this is really important for us because we really appreciate the support and some academic interest in what's going on in HIV in Russia. I wanted to tell a little bit about, unfortunately, Robert, I haven't been in Russia myself for already almost a year, so I wasn't able to work with my organization. I live in the Netherlands. Unfortunately, I haven't been able, but of course, as everyone else, we work in the Zoom, regime now, but I will share some results of our work as like a case study of what has been going on with the key affected populations, and my organization works with people who use drugs. So I have to announce that my organization, Andrei Rylkov Foundation, is a foreign agent. According to the Russian law, it's a public announcement I have to make. So to move on, I would like to share some just very brief overview of how COVID has affected our work and what we have done to adjust our services. And now, how to move this presentation. Yep. Okay, so Andrei Rylkov Foundation for Health and Social Justice is an NGO grassroots organization founded in 2009, and our mission is to promote, one second, just get rid of the panel. And our mission is to promote drug policy based on protection of health, dignity, and human rights. To achieve this mission, we use the following strategies. First and most important, the direct services, harm reduction to people who use drugs in Moscow, and community work. Second, documenting and reporting human rights abuse towards people who use drugs in Russia. We do a lot of public advocacy and UN level advocacy, strategic litigation to improve the Russian legislation in relation to health and human rights of people who use drugs. And we work a lot on public discourse and building political alliances in the context of the current dictatorship. So when the pandemic started, I think the first lockdown has been introduced in Russia on March 30th, and that immediately presented a lot of challenges for people who use drugs. We organized some community monitoring and ran two community surveys via Telegram in April. So the first month of the pandemic, we questioned 400 people responded to our survey. And then a month later, 200 people responded to the second survey. And the main challenges that people identified, this is people who use drugs, not necessarily injectors, but most of them are. So the main challenges are poverty-related insecurities and absence of economic safety nets, as well as absence of drug treatment and mental health support in Russia. 58% reported that they did not have any money left already after the first months of lockdown. Most, as you know, probably know, maybe not, that the president of the Russian Federation said that he sends everyone for 2 months vacation. So a lot of businesses just stop paying people. A lot of people use some random jobs and so on. So almost 60% said that they didn't have any money left or any resources, any income or support. 65% reported that their main problem became access to drugs, especially if they were dependent on some drugs. So because of the increased policing in Moscow, it was more challenging to go out and procure the drugs you need. And as it has been already said, the opioid substitution treatment is not available in Russia. So people who have opioid dependence are especially vulnerable, and most of them had to just like go cold turkey. Also several, like for example, the women's drug treatment facility in Moscow has been almost immediately closed and rearranged into the COVID ward. 37% decided to get drugs in the same way as they did before. So this is quite dangerous given that the system of drug purchasing in Moscow through the treasuries. 66% experienced mental health problems like anxiety, loneliness, and depression. Also, as an organization, we started to experience some political pressures. We are already foreign agents since 2016, and in this last year, 2020, shortly after the beginning of the lockdown in Moscow, we have been attacked by a Duma deputy who is responsible for like the Duma Committee of the National Security. He read an article. We cooperated a lot with mass media and published reports on the situation with COVID among the vulnerable groups. And he read one of these reports and immediately attacked us that we are like the main enemies of the Russian security in these circumstances, and that we should not care about such undeserving people, like people who use drugs. So it was quite strong. He accused us of drug propaganda and said that he will start some processes against us. So the political situation was not like very ensuring for us. So what have we done in order to adjust our services? Well, first of all, we had to stop some outreach activities, especially the everyday minivan raids to outreach sites. So we had to shift the focus to the community and to the volunteer networks that we have been building up through these years. And for several months, it's been possible to rearrange the service to make sure that most of our previous clients, they had access, kept having access to syringes and other prevention materials and services. We also shifted a lot of support to online, to Telegram, organized chat and organized like support group on the Telegram for people on quarantine. And most importantly, we decided to enhance our mental health service, which was like the main demand and the main necessity of people we worked with. So we started to work with an additional psychiatrist. We have 2 psychologists, and we tried to receive some additional funding for increasing these services. And now we want to focus more on like improving this service in its connection with the human rights work that we're doing and harm reduction work. Also, of course, we had to enhance case management, including in some cases of people with HIV who had to have and who had problems with accessing the AIDS centers. And we started to work on our gender-based violence protocol because, of course, in Russia, as everywhere else, gender-based violence also became very visible during COVID. And we had a case and we started to work in this direction. Unfortunately, due to these attacks of the Duma deputy, we had to close most of the website with important information about drugs and drug policy, but we were mostly vulnerable to fines and repressions through this website. So we decided it would be more safe if we stopped putting the public information. So it's kind of frozen now, but it still exists. Also, we ran several consultations with the Amnesty International and our other human rights groups, how to protect ourselves from these attacks. And we just now started a digital audit to improve the systems of digital security. And we increased the local fundraising. So just to share some results, we did not actually have to cut down. I mean, of course we had to rearrange the services, but we were able to keep them at the same level. So we see around 4,000 people a year. And last year we provided a little over 1,000 HIV self-tests. 256 people received some medical help via us. And of course, one of the most demanded services is legal aid and legal consultations. And we have documented 758 lives that we saved with naloxone that we give out to people, which also tells about increased problems of overdose, but sorry. Okay, sorry for that. So this is the brief overview of the main challenges that we faced last year in our work, and how we try to respond in this difficult public health situation and political situation to be able to continue our services for people who use drugs in Moscow.
Thank you so much, Anya. Kind of devastating, but thank you. Thank you as well for everything that you've just shared with us. Our next speaker is Dr. Anton Harriman, who works as an infectious diseases doctor at the Moscow Regional Center for AIDS Care and Prevention, which provides providing clinic care to patients with HIV and other infectious diseases. Dr. Harriman also serves as a medical director at the AIDS.Center Foundation, a leading nonprofit organization providing support to people living with HIV and key populations in Russia. Anton?
Thank you very much for the introduction. I'm very pleased to speak today discussing HIV in my country. And since I'm the only one person who is joining this webinar directly from Russia, I think we can easily realize that Moscow, we have a problem. And Russia still holds the first place by the number of new cases of HIV infection in the whole WHO European region, bringing almost 70% of a new infection in Europe in 2019. And the Ministry of Health in Russia says that the situation is stable. So it's very difficult to argue with that because like we have the approximately same number of new cases every year. But do we agree that it's fine? I'm not sure. My older colleagues compare this epidemiological situation to a bathtub with a tap full of water, creating a puddle. And despite the fact that medical community and many non-governmental organizations are doing a lot, these efforts only manage to wipe the edges of this large puddle. And at the same time, we all know that in order to stop the HIV epidemic here in Russia and wherever else in the world, it's not necessary to reinvent the wheel. It's necessary to use all the effective on the population level evidence-based methods, but these methods will need to be used in combination. And unfortunately, here in Russia, it's not the case, and not all of them are actively used in practice. And as we heard from the other speakers today, some these methods, for example, opioid substitutional therapy, is prohibited by law. So I've decided to focus on just two main issues, which in my opinion, do not provide an opportunity to radically change the current situation regarding HIV and AIDS in Russia. Well, first of all, I want to mention that I'm quite lucky and privileged in a way that I work in the Moscow Regional Center for AIDS Care and Prevention, because in our center, in our hospital, we are able to provide clinical care and antiretroviral treatment to every patient from our region. So it's very important. It's not always the case in the other regions in Russia. And moreover, we start treatment at the day after the diagnosis. So this is extremely important because now we all know that there's a U equals U statement, or undetectable equals untransmittable. So if person living with HIV receives effective antiretroviral treatment, this person cannot transmit HIV to their sexual partners. And if in theory we will provide treatment to every patient, we will not have new cases of sexual transmission here in Russia. but unfortunately, it's not a real situation. So for today, treatment is a part of the prevention strategy. And here in Moscow region, which is like suburbs of Moscow, but not Moscow itself, we provide treatment to every patient. And maybe it's not the best treatment in the world, but at least everyone has access to it. But today in Russia, only 55% of people living with HIV receive therapy. For many of them, for many people living with HIV, medical care still remains inaccessible. And if we ask us why do they have so many problems regarding treatment, I would say the issue is very complex, because on the one hand, some people do not go to AIDS centers and hospitals due to fear or lack of social acceptance of this problem. Others do not have necessary documents, because in Russia, there's this quite a long story about bureaucracy regarding being registered as a person living with HIV, because every person needs to have such a paper called registration, and this person needs to be registered at the place where he or she lives. So that means if you don't have this registration, you need to go to the place you were born or you were registered before to receive treatment. And as you know, Russia is quite a big country, so it's really hard for some people to go to other places. And also in some regions where there is lack of financing and lack of treatment for every patient, because despite the increase in the number of treatment coverage, in the numbers of patients receiving treatment, we still, and the budget does not grow proportionally. So we still have lack of financing for some regions. And to conclude this point, I would say that until we won't scale up our treatment programs, we will not be able to influence the course of the epidemic, because just over half of all people living with HIV in Russia are treated, and it's only official registered numbers. As we said before, we can be 1.5 million or more. And others, people who don't receive antiretroviral treatment, continue to be potential sources of infection. Another main point I wanted to tackle is work with key affected populations. As the previous amazing speaker said, that there's no doubt that Russian epidemic is significantly associated with key populations. And I would like to share our data from AIDS Center Foundation, where we organized the HIV testing program for gay and bisexual men in Moscow, St. Petersburg, and Nizhny Novgorod. And our data shows that approximately 1 in 10 MSM, so men who have sex with men, is living with HIV in these regions. This is another hidden epidemic, and it's not tackled by the government at all. And there is a special tool that can help us to reduce new infections in these populations. This tool is called PrEP, or pre-exposure prophylaxis. It's when HIV negative person received antiretroviral treatment or antiretroviral drugs not to be HIV positive. So it's like a prevention pills for every person who is HIV negative. And this tool showed very high efficiency in different settings, for example, in London, in France, in different other places in the world. And as activists in our community center, we decided to advocate for this program in Russia. And for example, last year, together with a group of my colleagues, we prepared a section on PrEP for clinical guidelines on HIV treatment and prevention in Russia. So we wanted to just mention PrEP as a highly effective tool for potential use in Russia. But this section was in preliminary version of these guidelines, but afterwards it was removed from the final version. We do not understand why this happened, but I think it's a good example on how all preventive measures are being implemented in Russia. It's very hard to advocate sometimes for some measures because some of them are just mistakenly or just removed from the final version because. And until we won't provide the full access to testing and treatment, harm reduction and opioid substitutional therapy, condoms, and PrEP, we will stay in such a stable situation. So I want to other speakers to continue this speech, because for me it's very important that we all together today discussing it. Thank you very much.
Anton, thank you so much for your remarks. Our final speaker today is Jake Rashbas, who's a senior program lead at the Elton John's AIDS Foundation, one of the world's leading independent AIDS organizations. The foundation's mission is simple: an end to the AIDS epidemic. Jake oversees the foundation's portfolio in Eastern Europe and Central Asia, one of the few regions of the world, as we've heard, where the annual rate of HIV infections continues to rise. Jake will be our final speaker today, and then we'll turn to Q&A. And so let me remind people as well, you should feel free to use the Q&A, and some of you have been doing so already as speakers are talking, and we'll turn to those questions shortly.
Thank you very much for the introduction. It's a pleasure to be with you all today. What I would like to do is share with you our perspective from the Elton John AIDS Foundation of the HIV epidemic in Russia, specifically how organizations on the ground in Russia have been innovating, like organizations like Anton's and Anya's. Very quickly, before I do that, just to tell you a little bit about who we are and what the Elton John AIDS Foundation does. So we were founded in 1992 by Elton John, the British musician, and our mission is to end the AIDS epidemic everywhere and leave no one behind. As my colleagues here have said today, Eastern Europe, Central Asia is the region where the HIV epidemic continues to grow. And for that reason, the Eastern Europe, Central Asia region is a real priority for us as a foundation, and Russia, as the largest country in the region, is certainly part of that. And I also just wanted to open with a quote from Elton John, our founder, because this really does sum up what we believe as a foundation. So Elton wrote in his book, Love is the Cure, that if we can find the love as a global community to agree that every life has equal value, if we can summon the compassion to provide treatment and prevention for everyone living with HIV, no matter who they are, where they live, how rich or poor they may be, we can end AIDS forever. And that really is what we believe. I know today there are lots of challenges in Russia and Eastern Europe, Central Asia. And what I would like to do is show some of the opportunities we see for making progress, especially amid the COVID-19 pandemic. And 30 seconds on what we do around the world. So in London, we've seen huge success, thankfully, in reducing HIV incidence. And every year, incidence, especially among men who have sex with men, continues to decline. And we're very proud of our contribution to that, especially with innovative financing. Globally, we work across 4 continents, and we support innovative models of HIV service delivery so that we can get closer to that goal of ending AIDS worldwide. Here are some of the techniques that we use across Eastern Europe, Central Asia, but also globally, to just kind of share what it looks like for those who might be less familiar with HIV specifically. So one of the points that we really push is integrated patient-centered care. So one of the issues we see is HIV being treated in silo when we know that people living with HIV have all kinds of issues that they might need support with. And we see that when there are these one-stop shops, where people living with HIV are able to access all kinds of services, we see much better outcomes. Similarly, in terms of how work is organized, micro-planning, so allowing the groups on the ground, not just the directors, but outreach workers, case managers, to guide their own work. And we see that that's a really good way to make sure that the work happens effectively. Similarly, task shifting. Doctors in particular are very busy people. They have lots of patients, and something we see works really well is allowing nurses, for example, and other non-doctor staff to take on the tasks that they are qualified to do, but doctors have traditionally been loaded with, and we see that that enables patients to be dealt with more effectively. And finally, before I turn to our work specifically in Russia, dynamic optimization of case finding. So that means making sure that we're testing people who are likely to have HIV so that we can link them to treatment and make sure that they can live healthy lives. So this is what we do globally for the last 20 years, more than 20 years now. And we've been supporting work across Eastern Europe and Central Asia. And as part of that, for the last 20 years, we've been supporting work across the Russian Federation. And here are just some of the things that we started doing at the beginning of our work in Russia. And so media campaigns, working with the most vulnerable, for example, street children, and creating support groups. What I really want to focus on is what we're doing now in Russia, because we're seeing really exciting things. And so our focus for the last 2 years has been on what we call lighthouse programs. And the idea here is in 3 cities, St. Petersburg, Moscow, and Novosibirsk, supporting NGOs working in partnership with AIDS centers, specifically providing services to key populations to make sure that those who are HIV negative can stay HIV negative because they're able to access the prevention services that they need. And those who are HIV positive can find out their status and be linked to care effectively. What kinds of results have we been seeing from this so far? So what we have seen is that it's when those AIDS centers and NGOs work together that we really get the results we need. And what we don't want to do is build a parallel system where NGOs are going everything alone, and then we end up funding leaves, which is something that happens in Eastern Europe, Central Asia. Unfortunately, often you end up with service collapse. So we are trying to build sustainable service delivery where these NGOs work with state-funded AIDS centers to deliver services to key populations. Here I've just shown some results of HIV testing activities. What we see is, I think one of my colleagues here talked about testing yields. So generally, out of all the people tested across Russia every year, 1–2% at most will test positive. What we see is that when there is really targeted community-based HIV testing, we find cases much more effectively, like Anton was saying, across these 3 cities in the range of 10%. And that will vary depending on the key population being reached out to. And people who use drugs tend to have a higher HIV prevalence than MSM, men who have sex with men, and then sex workers. And the final thing I wanted to turn to is specifically what's been happening amid the COVID-19 pandemic. I think there are so many challenges that have been brought up by COVID-19, not just in Russia, everywhere. But what we've been really happy to see is that communities have been able to innovate really effectively. Anya and Anton spoke about this a bit already. But I wanted to kind of speak through how we've seen our community partners on the ground changing their services over the last 10 months since COVID really hit Russia, and what the kind of results from that have been. So our priority when the COVID-19 pandemic started to spread, especially into the countries we work in, was to make sure that the HIV response doesn't get left behind. Yes, COVID-19 is a crisis that needs to be dealt with, but the HIV epidemic isn't going anywhere, and it's our responsibility to make sure that the communities we serve continue to access the prevention and care services that they need. And so that was kind of the big question on our minds. How do we do that? And our approach was to work with each partner and let them guide us on what they needed to change in their programming, depending on what city they were in, and depending on the COVID epidemic in that city, depending on the restrictions in that city, which were really the biggest kind of theme of what would be possible and what wouldn't be. And I wanted to kind of highlight 4 strategies in particular that we saw across our partners in Russia, but also worldwide. So the first strategy was introducing new modalities. So none of these modalities are totally new. NGOs have been working online, they've been doing home deliveries, they've been doing mobile bus work for a long time. But what we saw was that these kinds of modalities were either ramped up where they were already present, or NGOs that had been mostly focused on mobile buses suddenly really ramped up what they were doing in online and home-based service delivery. And not only we actually found, did that mean that organizations were able to continue delivering services? Interestingly, it actually resulted in organizations being able to reach segments of their target communities that they hadn't been able to reach before. which is a real silver lining of COVID-19, that, for example, people use drugs, men who have sex with men, sex workers, who the organization would have been trying to reach a long time, for example, in their offices, by delivering home-based services, they were suddenly able to get new parts, more hidden parts of their target communities to come out and access services. So that's been a really encouraging side effect of this shift in modalities. The next part is making sure that PPE, personal protective equipment, was available for all staff and volunteers in our project, but also really importantly, available for clients too. And that means not just when they come to an office or when they come to a bus that they get given a mask, although that does happen. It means that as part of the HIV prevention kits that clients are being given on a regular basis, that we're including masks, we're including gloves, which is a key part of PPE in some parts of Russia, and hand sanitizer, not just so it keeps them healthy, but because these are actually lifelines in lots of parts of Russia, especially when lockdowns were very intense. In some parts of the country, you literally couldn't go outside at parts of the pandemic legally if you didn't have your mask and gloves or travel on the metro. So by making sure that the most vulnerable members of the communities we serve were able to access those, we were really making sure that they were able to just live their lives as much as possible and not be faced with even greater isolation than they would be faced with already. I think the third thing here, and it relates to the challenge that my colleagues have addressed and touched on, which is, just like everywhere else in the world, COVID has been a real economic crisis for our communities in Russia, people losing their jobs, people being sent on holiday for multiple months at a time. What we've seen is that there are rising levels of poverty among the communities that we serve as a result of those of the pandemic. So one of the things that our partners have been doing is increasing other non-strictly HIV-related types of support, because if you can't provide your communities with food and basic hygiene tools, it's very unlikely that they're going to take care and keep taking their antiretroviral therapy. So one of the things that we've supported our partners to do is to increase the other kinds of support that they can provide to make sure that HIV care and prevention remains relevant for their communities. And the final point I just wanted to touch on here is specifically ART delivery. This is one of the things that we've seen partners across Russia doing. So working together with AIDS centers and making sure that clients who aren't able to leave their homes, perhaps that's because they have COVID, perhaps that's because they have young children, perhaps it's because they have a comorbidity and are most at risk for COVID. And we've supported partners in being able to bring ART from the AIDS center, where typically a patient would have to go and pick up their medication and bring it to them at their homes. Not just does that enable individual patients to be able to maintain keeping therapy, maintain viral suppression, which is so important for their health, but it also builds on that AIDS center partnership that we know is vital to long-lasting success in communities ending the HIV epidemic in the country. I'll leave it at that. Thank you very much. Happy to answer any questions.
Jake, thank you so much for your comments as well. I'm going to turn over for the first question. I'm going to turn it over to Sasha Spitalnik, who is the program administrator at the Jordan Center and who helped and who organized this panel, this amazing panel. So Sasha, would you like to ask the first question?
Sure, thanks, Josh. And sorry, this is a bit of a long question, so just bear with me. So everybody has touched on the crucial role that civil society and activism and voluntarism have played and will continue to play in fighting the progression of the AIDS epidemic and taking care of people who the government has overlooked. And this is a question really for everyone. With all of that, I was wondering, have you seen voluntary involvement among the general public increase or decrease or stay around the same? Like, what is the situation with voluntary involvement among the public. That could be as an actual physical volunteer going out and doing things for organizations, or as a result of crowdfunding and fundraising and things like that. It seems, at least as Anya was describing at the Andrei Rokov Foundation, that volunteers were able to step up during this time and fill in the gaps. But I would love to hear any other experiences that your own organizations or peer organizations or organizations that you have worked with have had. Is there a situation in which people could be compelled to take action in this sphere of work because of public health failures that they've witnessed in response to the COVID-19 pandemic and the sheer increase of need across so many demographics? And how are the new innovations in service provision that Jake, that you expanded upon just now, making involvement in volunteering perhaps more accessible? And if you could speak at all about experiences in regions outside of Moscow and St. Petersburg as well, that would be great. So thank you so much, and thanks for bearing with me on that long question.
I can start from our perspective. So I would say that COVID was another factor which helped us to receive more applications from volunteers and from people who are trying to help us in different situations. So for example, we have volunteers who helped us to deliver antiretroviral treatments for patients. At the same time, we received plenty of online applications where people wanted to help us with IT, websites, and so on. So we decided to organize a special kind of department in our organization to provide some activities and to organize support online. And at the same time, we see that many of our previous volunteers tried to focus on their work because they need to receive, first of all, salary for some work and then volunteer. And that volunteers realize that now we are not ready to help us because of their main work. So the situation is quite complicated. And if we go further from Moscow and St. Petersburg, for example, at our regional office in Nizhny Novgorod, we realized that during lockdown, it was like empty because no one wanted to go there and no one wanted to help because it's very hard to continue your everyday life and everyday work and at the same time to help us and to volunteer.
Would anyone else like to take an answer to that question? Anya?
Yeah, we've also been able to maintain our volunteer flow, and there was a lot of interest to our work. Also because of this, the government attack, and each time it happens is bad for us, but also our popularity raises, and we had a lot of people who wanted to support us in these difficult times. And we organized 2 schools of volunteers. So people are, now we are doing also the field work. So people are also involved. Unfortunately, we lost like 50% of our funding for harm reduction. And for the next year, I think we'll have to rely on this volunteer capacity that we have built much more, because we just don't have money to pay people, but it's going very well, and people are happy to support us, and we're happy to say that the community support of our work is growing.
I can also pick up on the second part of your question, Sasha. I think in terms of how the new kinds of service deliveries are affecting the level of volunteering in organizations, the key shift is the rise of online work. As we've seen kind of across industries, across the world, the shift to online work brings a whole new cohort who are able to participate in a given activity, for better or for worse. It's again one of those silver linings. And because of that shift towards online work, we have seen, and for some of our partners in Russia, that it means that you can get new people on board, especially those, for example, who aren't as mobile, those who are a bit more vulnerable, that wouldn't be able to participate as well in person, and being able to contribute online, whether that's by doing counseling, whether that's by doing testing virtually. We have seen that there is potential there. I don't have data though at this point that I can back that up, but that is what we're seeing kind of bird's eye view.
Alex?
Thank you so much.
Yep, thanks so much. So I want to combine a couple of the questions here. One is from Tinatin Japaritse, who asks, what are some of the issues pertaining to disinformation to public health and related to HIV/AIDS? This is now, of course, a topic, of course, with our current pandemic. And then I want to combine that with Victoria Haas's question, why is the HIV pandemic such a taboo subject in Russia? How can the government start to sensitize people with the topic? Would sex education in schools be the right first approach for that? But is there a relationship between disinformation and techniques of disinformation and the still taboo nature of the HIV pandemic? Dr. Heimer, I don't know if this is your area of specialty, but we haven't heard from you yet in Q&A. Would you like to comment on disinfo and maybe comment on some of the other points that were made too? We'll start with you.
Sure. I'm not sure disinformation is really the right word here, as is just no information or neglect. That if you don't talk about it, it doesn't exist, and you don't need to go to disinformation. So the fact that the local and national presses rarely cover, rarely present disturbing bad news means that you just don't hear about it. You know, even some of the, when I was traveling there, occasionally you would see, you know, billboards about HIV and AIDS, and they were very uninformative. They sort of suggested that everyone was at risk, which isn't true. They sort of suggested that the people who, you know, just by who they were depicting, were, you know, it wasn't disinformation. It just wasn't useful information. So I think that you know, if you don't, I guess there's an old phrase that goes, if you get them asking the wrong questions, they don't have to worry about the answers.
Fair enough. Any of the other panelists like to comment on this? Just some evolution in the information space around this education. Anton, I see you.
Yes.
Yeah, and then Ula, yeah.
I just wanted to mention that in 2016, that was the reason, the lack of information was the reason why we established a SPEED Center or AIDS Center website. Now it's like one of the most popular website on the Russian language regarding HIV and AIDS. And we see it's like the great tool to improve the acceptance, to improve the understanding of HIV and AIDS in Russia. And we still have problems with that. For example, here in Moscow, it's very popular, like an advertisement campaign saying that there's no such thing as a safer sex, for example. And you can find this in the billboards here in Moscow. And other many strange slogans and mottos saying that it's not perfect, like there's no such thing as a protection from HIV. You need to stay save your fidelity until the end of your life, something like that. So for me, it was the main reason why we are trying to tackle this and to speak about HIV publicly, and to say that now we need to change our narrative and to discuss HIV in a different way.
Ula, would you like to weigh in? Yep.
Yeah, I would like to add some information about sex education programs. So already in the 1990s, Igor Cohen, but also other specialists in Russia advocated for the introduction of sex education programs in schools, not only as a tool to inform about HIV, but in general as a important public health measure. But it was always said that no, these kind of programs, sex education programs, alien to Russian culture, so therefore they could not be introduced. And there had been many attempts of public international organization to discuss these issues, but still it's kind of totally blocked. And this is really, yeah, it's really very sad, because it would just be, yeah, I mean, these kind of programs can be organized in very different ways, and also the programs itself, they can be shaped differently, but yeah, there's no systematic education in this field in Russian schools, and so it means that children and teenagers, they only they receive their information from the internet, and some of these information can be useful, and other information can just not be useful. So there's and even more importantly, if schools do not offer these kind of programs, there's also no sphere where youngsters can discuss the issue. It's not only about information, of course, but also on relating to the issues. And yeah, so I think it's what has been mentioned, the neglect and some kind of taboo topic that's very much the case.
If I could just add one other element of this, which I don't think has been touched on yet. Something else that we see across Eastern Europe, Central Asia, including in Russia, is AIDS denialism. So many people who genuinely just don't believe that HIV exists, that it leads to AIDS. And that is a huge problem because it includes many people living with HIV. We could have a whole separate panel about this topic, but that I think touches on what we're talking about here, that it's not just people don't know about HIV, it's that they genuinely sometimes don't even believe that it exists. I think anyone who's worked in HIV in Russia knows people who've died as a result of that disbelief. And it's a huge problem that we see our partners across the country dealing with. Because it's just such a fundamental thing that every organization in Russia, I think, working on HIV needs to grapple with.
Anton, did you want to jump on that?
Yeah. Just a quick comment on that. I have several patients who are officially HIV denialists, and they receive treatment because it's very important to speak with people and to discuss this issue. And sometimes they still don't believe that HIV does exist, but will receive treatment. And for me as a doctor, it's like a success. I did everything that I can.
Great. Thanks everyone to the answers to those thoughtful answers to those questions. I want to take the conversation in a slightly different direction here, which is to ask Lisa Sundstrom's question, and which was very much the question, which is very similar to the question I had written down myself in my notes that I wanted to ask the panelists. And I think this is probably for everyone except potentially Anton, although Anton, feel free to jump in if you want as well, which is the question of how foreign agent status is affecting people's activities. And how does it affect specifically your group? How do you think it is affecting more generally attempts to deal with HIV/AIDS, all the work that you are involved in, and even more generally, sort of humanitarian work in general here? So feel free to answer on kind of any level. Anya, you made the perfunctory, nod in the direction of your legal obligations, although this is a US-based broadcast here. So, but in general, is it hampering the work that you're able to do? In particular, Lisa asked about, does it affect your group's ability to work with the Global Fund and UNAIDS? How much has it, and I realize this is just some of this is quite new at this moment, but is it affecting how your groups and how your research and how your work is looking going forward? So Anya, if you want to answer first, but I'd be interested in hearing from everyone else on this.
Yes, sure. I will answer this question. We've been a foreign agent since 2016. And I think in this year, around 5 or 6 other HIV organizations have been included in the registry. And I think most of these organizations had to shut down their activities because the burden of legal responsibility and the financial responsibility was too high. Fortunately, we've been able to adjust and continue our activities. The limitations that we have now is that, well, as you've seen already, we have to make an announcement every time we present in the public. Every time we issue some informational materials, we have to stamp it with a foreign agent stamp, so people are aware that we've been included in the registry. We also have to carry out a yearly financial audit and report it to the Ministry of Justice. And the reporting to the Ministry of Justice has increased. So it's an additional burden for our administrative capacities. We also are restricted from access to basically any national, like federal presidential grants or local funding. There is some funding, not maybe typically for harm reduction, but there is some funding for health issues that are available, and our colleagues from other HIV organizations in Russia enjoy some funding from the presidential, I don't know, enjoy or work under the funding of the presidential grants and some local funding, but for foreign agents, it's unavailable. But in many ways, it's a kind of relieving situation for us, because at least a lot of our colleagues, they had to stop their advocacy work. They had to stop their human rights work because they were afraid to be included into the registry. But once you already included it, you know, you don't have like anything. I mean, you still are vulnerable to a lot of fines and attacks and so on, but at least you don't have to consider this. And unfortunately, just I think like last week or 2 weeks ago, some of our colleagues have been included in the list, including the organization from St. Petersburg, Humanitarian Action, which has been nominated by our national dialogue as the principal recipient for the Global Fund grant. So how it will affect the grant implementation, we don't know yet. We hope it will be still possible, but I think it can be viewed as the direct kind of attack already before the grant has happened. We got the grant approved last year, but the work has not started yet. So this is, I mean, it's kind of scare tactics, and it's kind of to keep you at some kind of control, but also a liberating thing, you know, that can happen, because at least we are not afraid to speak up about human rights, about substitution therapy, which none of our colleagues are, you know, daring to discuss in public. So this is the situation.
Ula? You're still muted right now.
Thank you. I would like to add something to this. I think we also have to keep in mind how this foreign agent status, I mean, what kind of effect does it have on the Russian population? Like normal citizens, they might just, be, not, I mean, they might just not want to donate money, I mean, make private donations or volunteer. They might, I mean, if they have limited resources, they rather go to good organization, an organization that it has also the backing of public institutions. And so, and this makes the community of AIDS service organizations and the activists, it becomes more and more isolated. It's only those people who already work together with these organizations. And that's, I think, also really a risk, because it doesn't give the organization the opportunity to reach out to the public and to speak about their issues and to maybe increase their donations or inform the public. Because citizens who do not want to be linked to the foreign agent organization, even if they do not know exactly, or but it's rather something that you do not want to have something to do with. And this, it's a great barrier for organizations in general, and it's very important to see that it's only part of the organizations that is affected by this. So HIV/AIDS organization are one, but it's also human rights organization and environmental organization. And it's not by accident that it's the more critical organization that are affected by the foreign agent law. And like purely social organizations are not affected by it.
Robert or Jake, did you want to answer this? No. Okay, back to you, Alex.
Yeah, thanks. So I'm going to combine another couple of questions, one off YouTube from Yanis Zilagakis. How do you handle undocumented immigrants? How do you register and monitor them? And then also from Gulnaz Izabekova, question for Dr. Harriman. Is the antiretroviral therapy available to the migrants working in the Moscow region, i.e. the non-citizens of Russia? I think this would be, and also others if they wanted to explore the topic of, what and when are HIV-related testing and treatment options available to legal and illegal migrants?
Thank you for that questions. In my opinion, migrants and especially non-citizens of Russia are the most vulnerable category of people among all, because we cannot receive treatment for free here in Russia. There's only one exception for Belarus. But for other countries, we cannot receive it for free. And officially, according to the law, we need to be deported if we are HIV positive and they are registered. So if there is a HIV positive result in official laboratory, it will be sent to the kind of registered, and afterwards you need to be deported. In real life, we're not always deported, but at the same time, it's a kind of way to criminalize this group and to exclude them from the helping system and exclude them from the care system. So together with some other organizations, we have some small programs for migrants here in Moscow, and I with my colleagues provide a kind of counseling for them. Usually it's unofficial way, so I don't know their names and I don't register them anywhere, but at least I have counseling, and then they receive treatment with a special kind of documents because there's a project for them. But in other cities, it's very complicated, and I don't know, with maybe another hidden epidemic among the migrants.
Yeah, there are sort of two categories of migrants that our people have come in contact with. There are the migrants who are registered to work in Russia, and then there are the illegal migrants. And the situation is probably worse for the illegal migrants because they are working and sending money home, and the only time they go back home is when they're already very sick and can't work anymore. That's probably true for the legal migrants as well. So in the meantime, they have the potential to spread HIV among other people with whom they're having sexual interactions with, and they certainly go home and start to receive treatment where they can. And most, this is especially true for migrants from Central Asia, where they'll receive treatment, but by that point they're already quite sick, and many of them, in fact, live for a very short period of time once they go home. Many of the countries in the Caucasus and Central Asia report that the vast majority of people that they see at their AIDS centers were infected in Russia while working, and not, this is not a lot of local transmission going on.
Great,
So
thank
maybe,
you. Yep.
Alex, maybe we have time to squeeze one more question in. There's a question from Brianna Caminello, who asks whether this lack of information surrounding HIV in Russia is mostly seen in the general population, or have any of the panelists witnessed this in members of the healthcare field? For example, has the lack of HIV education negatively affected the way Russian physicians understand and treat HIV? And if so, how are outreach organizations overcoming this barrier? So Anton, maybe you could start with that. Obviously, you're in a very specialized unit. Do you see there is a kind of, I don't know, vis-a-vis your colleagues who work in specialized AIDS treatment in the West, or even outside of Russia and other parts of the world, do you see less knowledge of HIV and AIDS among your colleagues who are not specialists in this area?
Unfortunately, yes. I could say that, especially from all the generations of doctors, they know nothing about HIV. They still think that HIV is like a death sentence, and this is it. So for many friends, I usually, for my patient, for example, I send them to the, surgeon, and they decline to take him because just he has a HIV positive status, and this is the reason. We're not officially putting it into the paper, but of course we're saying, oh, we are not ready to provide healthcare to you. And this is a typical situation in every city in Russia. So for younger generation, it's quite different. And I can say the situation is quite better because now in the universities, you learn something about HIV and you at least know something about how the transmission is going and about the undetectable, untransmittable, and so on and so on. And also about our work and our organization, we established a special project for medical students and young doctors, collaborating with UNAIDS and collaborating with our organizations called Vera HIV Med School. It's a special training camps, 7 days each, and we are providing the full information for young doctors regarding HIV and AIDS, regarding social aspects, about key populations, and we are doing a lot to educate a young generation of doctors.
Great. And I actually would like to end with Annie Sundelson's. How can we get involved in the HIV harm reduction work going on in Russia? And I think it also brings up issues not only of advocacy and volunteerism, but some of these practical legal matters too. I don't know, Anya, would you like to take a swing at that one?
Well, I think it's great that, first of all, you guys are not losing the focus on Russia and on HIV situation in Russia, because both issues are kind of fading away, and especially with the pandemic, like nobody, wants to care anymore about the public health response to HIV. In Russia, we are losing our international donors. Of course, the local funding does not go towards any activities with the key affected populations. So it's very important for us that the international funding is still available. Unfortunately, most of the international donors are also turning away from Russia, and some don't believe that it's possible to do anything in Russia. But as you see from this panel and from the great work of my colleagues from other NGOs in Moscow and other cities of Russia, that the work is going on, and we are providing some public health resistance, and we are able to continue the services for the vulnerable and key affected population. So it's important to remember that we exist and that we are struggling really hard. And thank you very much for your support and for raising the issue.
Thank you so much. So on that note, our time has come to a close. I would just like to thank all of you for really an amazing conversation. Thank you, Jake. Thank you, Anya. Thank you, Robert. Thank you, Ula. Thank you, Anton. Thanks to the audience for sharing your lunchtime and evenings with us. Thank you, Sasha, for the idea for the panel. And of course, to Josh, as always, my partner here. And just a reminder to you, our next session is planned for February 1st on Monday. That will be, the topic will be corona vaccination and its politics. We don't have the lineup quite set yet, but stay tuned for more information on that coming out in the next few days. Goodbye, everyone. Thanks again, and stay safe and healthy.